Wherever life plants us, bloom with grace. Life is a wonder. Every day in our life matters, and what makes it count is a simple smile of happiness. Welcome to MVR Cancer Center and Research Institute. We believe in eternal happiness. One of the finest cancer centers and research institutes, MVR CCRI, is named after Kerala's renowned veteran leader, M.V. Raghavan, in recognition of his contribution to the cooperative sector in the state of Kerala. A milestone in India's cooperative sector, MVR CCRI connects international experience and healthcare services with a world-class facility.
MVR Cancer Center and Research Institute is the first multidisciplinary standalone cancer center. Came up 3 years ago in Kerala. In 2012, some of us like-minded people under the leadership of Mr. Vijay Krishnan formed this care foundation with an aim of delivering world-class cancer treatment at an affordable cost to the people of this area. This hospital has 35 different cancer-related subspecialties and 35 departments working. And also we have about 60 odd very well trained expert doctors in the for the management of cancer are working in this hospital. So we have a facility for all cancer treatments like surgery, radiation, chemotherapy, immunotherapy, and any other form of treatment currently practiced in the world. We have about 8 surgeons, surgical oncologists working in this hospital, and about 8 modular theatres, state-of-the-art theatres for the surgical management of cancer. We also have 2 linear accelerators, very latest equipments, and it can take about 100 to 150 patients for radiation per day. And all these latest radiation equipments can give radiation with a very accurate dose. We have a large 80-bedded daycare chemotherapy unit as well as 12 world-class BMT suites under medical oncology. When the cancer is progressing with all the standard treatment, and when bone marrow transplant is the only cure for them, we have facility for taking up 12 patients at a time. We also have a well-equipped pathology department, transfusion medicine department, a microbiology department, and an infection control team, as well as we have other supportive departments like medical nutrition and well-equipped physiotherapy department as well. This hospital so far has treated about 30,000 patients for a period of 2.5 to 3 years, and we have performed almost 6,000 to 7,000 surgeries with a complication rate of less than 5%, which is a remarkable achievement. And we have delivered radiation for more than 20,000 patients. Also, we have facilities for clinical trial. Clinical trial is a department which offers a new treatment which is not in practice, but it is available as part of trial, which is available as part of multi-centric, multinational trials, whereby patients can experiment treatments which are not at the clinical use. By this method, even patients can have treatment which is going to come 15 years later. So this hospital is well equipped, and the team of doctors are having good experience and experts in the field in the different subfields of cancer treatment, as well as we have a very good team of paramedics which deliver the treatment without any complication or without any failure. So our aim is to get the best results out of our treatment, and I'm sure with this type of team and the equipments, we can deliver the best, and we aim at achieving the status of the best hospital in the world by 2020.
The hospital's state-of-art design, functionality, and technology makes us one of the most modern hospitals in the subcontinent. Our passionate team of professionals and their patient care helps us provide accurate diagnostics round the clock during any emergency.
I am Dr. Prashant Parameshwaran. I am consultant in Department of Medical Oncology and Hematology at MVR Cancer Center, Calicut. I am in charge of hemato-oncology and bone marrow transplant program in MVR. We are offering a complete hemato-oncological program, state-of-art leukemia induction unit. We take care of lymphomas, multiple myeloma. We have a well-equipped blood bank, an apheresis unit, and a state-of-art hematopathology, which includes 10-color flow cytometry and all immunohistochemical markers. We are having a bone marrow transplant unit, which is a kind or one of the biggest in Kerala, with around 11 transplant beds. We have done autologous bone marrow transplants for myelomas, lymphoma, and allogenic bone marrow transplant for acute myeloid leukemias. Aim is to make it as a state-of-art unit, and we have already started postgraduate training programs. We are planning for more and more training programs in the field of hemato-oncology and transplant.
Our surgeries are conducted in a world-class, fully integrated operation theatre complex with 8 operation theatres and a high-end cath lab within the complex.
Department of Surgical Oncology at MVR Cancer Center and Research Institute has 10 consultants which work in a site-specific and organ-specific manner. Each consultants have got exemplary vertical skills apart from good horizontal skills, and they take care of certain areas of interest pertaining to their areas of expertise. The department has got 8 state-of-art theatres, and we do around 200 to 250 surgical oncology procedures every month. Few procedures are specific to our institute, like we have got a department of peritoneal surface oncology where we do cytoreductive surgery and HIPEC, and we do around 60 to 70 cases per year, and it's one of the most high volume center in South India. We also have good expertise in bone tumors where we do limb salvage surgeries with custom mega processes, and in fact our amputation rate is less than 5%. We also have got great expertise in breast tumors where we do a lot of breast oncoplastic procedures, taking care of the oncological aspect as well as the aesthetic aspects of the breast. Our breast conservation rate is around 75%, and we do mastectomies in only in 20-25% of patients. Apart from that, the department works in unison with medical oncologists, radiation oncologists, rehabilitation, and other allied specialties, and we work in a multidisciplinary team approach. Thank you.
The blood center in MVR Cancer Center and Research Institute has been developed as a 100% blood component issuing blood center. We are focusing on collecting blood as much as possible from voluntary blood donors, of which we have reached almost around 80% of our blood components being issued are from voluntary blood donors. In the aspect of reaching to that expectation, we are conducting at least one blood donation camps per week, and we have been able to achieve the blood license, all components that is being possible to be issued in India. And we have also developed our blood bank to a status of hematopoietic stem cell collection and processing.
Hope on Wheels. Our hearts puff up with pride to introduce you to our moving hospital. Yes, a hospital on wheels to extend our medical support to the remote corners of the country. A fully functional mammography unit, an advanced laboratory, and a team of talented technicians rendering their genuine services.
The laboratory services of MVR Cancer Center have excellent facilities. We have the departments of pathology, which also includes histopathology and hematology, clinical biochemistry, microbiology and serology, and molecular oncology. Under molecular oncology, we also have cytogenetics. So basically, the laboratory services here are fully equipped to cater to the oncology patients. And we offer services at very reasonable, patient-friendly rates. We always try to keep up to the best of quality, use the best of ingredients, best of kits, and try to give reports in a very competent manner. We have also started COVID-19 testing. In fact, we were one of the first private labs in Kerala to start the real-time PCR testing for COVID-19. And we were one of the first labs, private labs in Kerala to be recognized to do the RT-PCR test for COVID-19.
A dining experience offering cuisines that pleases versatile palates. Care store that caters all your basic needs. Delicacies from the Care Cafe with a lively ambience and other warm services to rejuvenate you. They say that if you have a library, you have everything you need. Yes, we have an exceptional library. Our comprehensive pediatric care consultants are specially trained in taking care of children.
At MVR CCRI, we have a dedicated pediatric oncology department dealing with all disorders in children. The hospital here has a very child-friendly campus with a dedicated child-friendly OPD area, daycare facility, as well as inpatient care. All the staff involved in the care of children are specially trained for pediatric patients. We treat all children, whatever be the age, from newborn to older children, adolescent children, with blood-related disorders as well as cancer-related disorders. The treatment period during pediatric cancers is a very stressful period, and we make sure that all the children who receive treatment here have a child-friendly atmosphere during the whole period of their care. We have a good dedicated play area as well as all areas which are dedicated child-friendly areas.
Department of Radiology at MVR Cancer Center offers a complete spectrum of the leading-edge technologies that the medical world operates on.
Hello, good evening. I'm Dr. Dinesh, Head of the Radiation Oncology Division at MVR Cancer Care and Research Institute. Our department, Radiation Oncology department, has commenced functioning 3 years back with 2 state-of-the-art LINAC facilities which you're seeing now. This is our first LINAC which was commissioned way back in 2018, I would say. And we are treating around 110 patients daily on this machine. Even during COVID times, we are extremely busy because most of the referrals for cancer treatments cannot be delayed in spite of these difficult times. And what these linear accelerators entail us to do is, it helps us to give very precision radiation therapy, because radiation oncology practice have changed over the years, and it is extremely important to deliver the radiation dose precisely to the target volume. So we take extreme care in seeing that our patients are treated in the right way, in the right manner. As you see now, we are just giving you a demonstration of a patient lying down on the couch, and this is a very, very important machine in the sense that we are able to image the patient during treatment for the right targeting of the tumor. So we have got a cone beam CT, we've got imaging facilities, we have got facilities for stereotactic body radiation therapy, stereotactic radiation surgery, we have got micro MLCs for very precise targeting of the treatment. The key factor in radiation therapy in this era is precision radiation therapy, and we use immobilization masks in all these patients in various ways to see that they don't move during treatment. And this is the mask we use on these patients, and we fix it over the head. And for children, we use very special devices like vac clogs. We use individualized mask. For children, we have devised to improve the tolerance and to reduce the mask anxiety. We paint some good designs, and this is done by our technologists, so that it's a very friendly way of administering radiation therapy, so that they won't be anxious during treatment. So very personalized care, even in spite of having the best of technology, is important to improve the compliance of these patients during treatment. And this is one of our strategies. And this is done by one of our own radiation technologists with his artistic skills.
Our trained nurses, the angels, are compassionate soldiers. Their passion to serve ensures that you are promptly and professionally taken care of. Our vision is to strive for clinical excellence and continuous improvement in service quality, and uphold a system that ensures medical practitioners of the highest standards. Resting in nature's lap, MVR CCRI, with the lush greenery and tranquility of the Western Ghats, is a place to make you feel at home and recover. We are the people. We beat cancer. It is not your battle. It is our battle. MVR Cancer Center and Research Institute, committed to conquer cancer.